Osteoarthritis is a degenerative condition involving the joints of the body. It's a wearing down of the cartilage in a destructive process that results in loss of the shock absorbing effect of the joint, progressing to joint stiffness, joint pain, and basically debilitating the individual. Golfers, tennis players, what we might call weekend warriors, that are finding that their love of the game is being diminished by the fact that they have this degenerative process, and they're putting down their tennis racket, putting down their golf clubs, and maybe settling for something less or kind of giving in to the degenerative condition that they have. Perhaps 50% of patients that I see with arthritic changes to their knee, it's isolated primarily to one compartment. So those patients are very good candidates for a less invasive, more of a resurfacing of the knee joint in the localized area where the arthritic disease exists. Here at West Boca Medical Center, there is a recent addition to our ability to do surgical procedures involving robotic technology. It allows for a very precise placement of implants that are utilized during surgical procedures that prior to this was not possible. The advantage with the robotic technology is that the incision is even more minimized. It's a smaller incision, and it allows for the placement of the components that are basically resurfacing the joint to be put in such an exact way that they're not going to wear out over time. So we're able to get a visual appearance preoperatively of the knee with a special study called a CT scan of the knee, which is basically a three-dimensional model of the knee. It would be like taking an x-ray of your knee and walking around you 360 degrees, and then taking vertical planes and horizontal planes and looking at the knee in all its different configuration. That allows us to then have a plan in moving forward. Studies have shown that we're placing this in a position within 1 millimeter of what our preoperative planning is. So if we're able to successfully place the implants in their exact position that we determined preoperatively, then we know that they're going to glide and move in a fashion as somebody is using it over time in a very efficient way, and there will not be a malalignment. I think the concern that most patients have are related to the pain management. With the help of our anesthesiologist at the hospital, commonly there is it's called a block that's given. Anesthesiologists are injecting an area in the lower back. That's called a spinal block. And then they do a femoral block, which is an injection of a local anesthetic around the thigh to more or less numb up the leg for a good period of time. And then we have intraoperatively techniques and medication that can be injected around the joint into the soft tissues that are long-lasting and effective in that initial process of alleviating the pain. The post-operative phase has been fast-forwarded. Everything is moving at a quicker pace. For example, typically I do this procedure in the morning, and I have the patient up and standing and starting to get the feel of their knee that afternoon. Patients are therefore moving right away. They're functioning right away, and we're able to shorten the hospital stay, and patients routinely are able to get out of the hospital in a 1 or 2 night fashion. It's theorized that in the future, with even better techniques of managing these patients, that they may even be able to go home the same day. The population that has had these robotic unicompartmental knee replacements, 75% are without any assistive device, meaning a cane or a walker, by their 4th surgical week. That's not something that any surgeon would see with a total knee replacement. To be able to use this technology, as well as the intelligent instrumentation, and being able to combine those two sources to provide this technology for our patients is a game changer.